Hello. Hello, everyone, and welcome back to our Just for Hearts YouTube channel. It's dietitian Siley. I welcome you all on behalf of Just for Hearts. Hope you all are safe at our homes and enjoying our quarantine period. So today we are again back with another interesting topic, and that is back and neck issues faced by housewives. So many a times like we feel the back pain, but we don't focus on it, or we don't do any exercise or any workout for it. So today we have a expert with us, Dr. Nidhi. She is a physiotherapist, and she is a certified physiotherapist and done many corporate sessions and seminars on spinal issues for corporate people. And also she is doing currently online sessions for them. So welcome you, ma'am, on our platform. So we are very happy to announce that we are taking such sessions for housewives also, and which will be beneficial for them in this period, because they are doing a lot of work in the house. All people, all children are in the house, and they need to do more and more work for them. So this will be surely very much helpful for housewives now. So without wasting any time, I will hand over to you, ma'am, and you can continue with the session.
Thank you so much, Siley, for the introduction. Hello, everyone. I hope all of you all are fit and healthy during this time. But are you all suffering from a niggle of back pain, neck pain at some point in time because of doing all the household activities and not having much of domestic help? So, my main motive of conducting this session is to let you know that you do not have to work with that kind of pain. That pain is something that can be easily prevented if you incorporate certain basic prevention strategies in your day-to-day lives. Next slide, please. So the agenda for today's session would be, I will be talking about the common aggravating causes of neck and back pain. Then I would talk about the types of back and neck problem, followed by a few prevention strategies along with the exercises that you could perform on a day-to-day basis. And at the end, we'll be having an interactive session. Next slide, please. So beginning with the common aggravating causes of neck and back pain. Now in the slide, you could see there are 4 images. I'm sure you would be able to relate to at least one of them. In all these 4 images, one thing that is common is an awkward posture is assumed. And repeated assumption of an awkward posture is one of the most common aggravating factors for neck and back pain. Next slide. Having talked about one of the common aggravating factors for neck and back pain, I now want to talk about another common factor. With the advance of technology, all of us are prey to using smartphones. Is there anyone out here who doesn't possess a phone? I don't think so. Now let's see if these smartphones are really smart. Ideally, the neck has to bear a pressure of the head, which is approximately 4.5 kilos. Now, when you start looking down into your phones, the pressure on the neck increases to as much as 27 kilos. That is the weight of an 8-year-old baby. So you can imagine the amount of stress that comes onto your neck in just one go. Studies have shown that people use their phones for 4 hours a day. So you can imagine the cumulative stress that comes onto your neck at the end of the day, which is definitely not good for the neck. So tech can be a pain in the neck for sure. Next slide. Okay, so now I want to talk about the types of neck and back problem. I'm sure you would have come across terms like spondylosis, sciatica, slip disc. Now, what do these terms actually mean? Spondylosis is nothing but an aging process. It is something as simple as graying of hair or presence of wrinkles on your face as you age. There are certain degenerative changes that take place in the spine as well. Now, what are they? There are small bony outgrowths called as osteophytes which come out from these bones, which may cause a certain restriction in your neck movements and may also give rise to pain. Another change that takes place with spondylosis is the thinning of a substance which is called as the disc. The disc is a very vital structure which is present in the human spine. It's because of this disc that movements take place in the spine, like forward bending, backward bending, sideways, twisting, turning. It's all because of the presence of this disc. Any force also that comes onto the spine is first absorbed by the disc. So the disc, it acts like a shock absorber. So as you age, the disc, it shrinks in its size. So indirectly, the functions what the disc was serving, somewhere down the line, it gets affected. So in a nutshell, spondylosis is nothing but a degenerative condition with wear and tear of the spine disc. Next slide. Another commonly used term is slip disc or sciatica. Medically, it is called as prolapsed intervertebral disc. Now, why does this slip disc occur? If you assume awkward postures for an elongated period of time, or if your routine involves a lot of bending forward and lifting up heavy weights on a routine, then the disc which is present between the two vertebrae, it bulges out a little bit from its position. So this doesn't happen overnight. It happens over a period of time. One more thing that you should be aware of is a lot of nerves come out from the spine. Now, when this bulged disc, it touches the nerve, you start feeling tingling, numbness, and pain kind of a sensation. That's exactly what happens in sciatica. Now, slip disc can happen in the neck region. It can happen in the lower back region as well. If it happens in the neck region, then you feel the pain, tingling, and numbness going right from your shoulders to your elbows up to your wrist. If it happens in the lower back region, you may feel the pain and numbness and all going from your buttocks to your thighs to the calves, the sole of the feet. So it is indeed a very unpleasant sensation. If one of you all have experienced it, you all would be able to relate to it. So in a nutshell, sciatica or slip disc is nothing but a bulged disc which is irritating the nerve and causing a tingling numbness kind of a sensation. Next slide. So having talked about the common aggravating factors, about the types of back and neck problem, I now want to talk about the most important part, the prevention strategies, the reason as to why all of you all are sitting so patiently for the session. So in the first image, you can see that the lady is ironing. So instead of standing and ironing, sit and iron. You will give a great relief to your lower back as well and to your neck also. If you're washing the window frames, instead of using a cloth and washing it and repeatedly bending to look into the bucket, you can use a wiper and wash the window frames. If you're cleaning a commode or the washroom, again, instead of bending down and using a cloth to clean it, you can again use a mop and then clean it. It will again reduce a lot of strain on your back and neck. Next one. Okay. Now, if you're lifting something heavy from the floor, so how do you lift it up? Do not bend from your back and lift it. First, get close to the object. Bend your knees, keeping your back straight. Then keep the weight close to your body and then stand up and then start walking. And if you have to turn around, then turn by stepping. Do not pivot. Because if you pivot, it will cause a lot of strain on your lower back as well. Next one. Okay. So having talked about a few prevention strategies, I will now be showing you all some quick exercises which you could do it in the sitting and standing position. So you don't really have to go to your bed to do the exercises. Very easy exercises which you can just adjust in your routine. Even if you're standing in the kitchen, you can quickly do it. So here I'll be sharing a few exercises with you. First, I'll start with the neck and in the sitting position. So you can just sit on the chair, relax yourself, let your buttocks touch the back of the chair. Then gently keep your fingers on the chin and just tuck it in and come back. Be there for 1 to 2 seconds and come back. One more time. So each of these exercises, you could do it for 10 repetitions, 2 to 3 times in the day. Now, the second one, I would request all of you all to keep your hand over your head and gently bend to one side. You will feel a good amount of strain on the neck. Come back. Again. Hold that stretch for a few counts. Come back. You could do the same thing on the other side as well. So I hope you all have understood these two exercises. Now, for the third exercise, I would request you to keep your hand in this fashion and then just look down towards your pocket. Again, hold it for a few seconds and come back. One more time. Now, the same thing on the other side as well. Keep your hand like this over your head and gently bend down and come back. Look down towards your pocket. Come back. One more time. Okay. So I hope you all have understood these three exercises. Now, for the fourth exercise, I would request you to keep your hand here and gently take it outwards, broaden your chest, and come back. Again, and come back. Again, and come back. So this exercise is very good for your upper back. One more exercise for your upper back, wherein you can just clasp your hands and keep it behind your neck and bring your elbows together and gently take it up and down. Let your elbows face the ceiling. One more time. One more exercise that you could do is very good for your spinal movements. For the rotation bit is this. Hold your hands like this and move it here and come back. Same thing on the other side. So I hope you all understood these exercises in the sitting position. Now I'll be showing you all a few exercises for your lower back in the standing position. For that, you need to keep your hands at the small of your back and keep your feet shoulder width apart and gently bend backwards and come back. Do not look up, look straight so that there is no stress on the neck and come back. One more time. For those who are facing difficulty in doing this, there's a simpler way of doing it. Just keep your hands like this on the wall and let your stomach touch the wall. So both these exercises are for your lower back. Now there's one exercise for your upper back in the standing position, which is again very simple but very effective. Keep your hands like this, just slide it up and take it down. Just slide it up and take it down.